Every cancer journey is different. Every child, every family, every response is different. But the underlying theme is that your kid is sick and you need an option.
We definitely knew, right, that this is sort of like a new chapter that we're moving into.
I was hopeful, but I was terrified, as I always am.
We had put all these hopes into this opportunity, this chance. It's overwhelming with all the information they give you, and it is information overload, no doubt. But if you can just take piece by piece and sort of latch on to that, Gabby's tumor mutation is the KIAA1549 BRAF fusion mutation. I know it's a mouthful, but it's important to know those little details.
When Olive had a sample taken of her tumor,
we weren't really sure if there'd be enough sample collected to really tell, if she would qualify for this trial or what.
But they were able to determine that she had changes in the BRAF gene, and that cleared us for being a part of the study.
The last piece that really, really made probably the biggest impact for me is Ojemda was made for kids.
What is Ojemda, tovorafenib? Ojemda is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene.
This drug was tested on kids for kids. It's not been a modified dose from adults.
I think the excitement that our care team had to see them excited about getting Olive into a trial gave us a lot of peace of mind.
The overall treatment plan was manageable, and it meant so much for us for Olive to be able to take the medication once a week at home, with or without food. We weren't going to the hospital every week. It was amazing.
We really appreciated was the fact that you could take it at home once a week, and it wasn't that constant litany of being stuck in the hospital and doing all those things.
She would take her medication every Friday morning before school for the length of the trial.
She had hype music, there was dancing. It was a pretty exciting event.
It meant we did not have to schedule when we were going to the hospital to go get her therapy. We could actually do it at home once a week. While Mila was on the trial, we would go into the hospital so that she could be regularly monitored. We went in every 3 months to get an MRI scan. When you're dealing with PLGG, every single scan is nerve-wracking. You don't sleep the night before, you're so worried about the results. There's no way for you to know what's gonna come up on those scans.
I remember being really anxious about that first scan on the drug, but yet hopeful that we were going to see a good answer.
Between the MRI and when you get the results, it's like an exercise in not thinking about it.
Yeah.
At least for us, right? I don't think that we're sitting there like wringing our hands. We're like, how do we distract ourselves until that moment when the door opens and they pop the head in and they say,
It's great.
Things are better.
Yeah.
When we got the report that said there was slight shrinkage, we were over the moon. We were just felt like we're on the right path.
The doctors came into the room and the look on their faces kind of said it all. Mila's tumor had shrunk after only 3 months on the trial drug.
When they popped their head in and just told us it's great, like good news, I just felt like, okay, we can relax, right?
Yeah, kind of an exhale of, tension that you're holding that you didn't know you were even really holding.
Yeah. So it makes us that much more proud that our daughter was a part of that.
What are the possible side effects of Ojemda? Ojemda may cause serious side effects, including bleeding problems, hemorrhage, skin reactions, including sensitivity to sunlight, photosensitivity, liver problems, slowed growth in children. The most common side effects of Ojemda include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection.
So when we make treatment decisions, we weigh out side effects, we do research, we work with our care team.
We had an amazing care team who we trust so much, and they started to talk to us a little bit about the side effects. What they could tell us was information that we could kind of wrap our heads around, and we felt comfortable with it. So we decided to trust the care team once more and decided to go ahead and give the trial for Ojemda a shot. Mila did have some side effects while on Ojemda. She had a rash on her body and on her face.
I think it was a couple of weeks in when she started to get the rash.
As a part of the home treatments for Olive's rash, we did a lot of bleach baths, which sounds wild, but it's just a bath with a little bit of bleach in it.
She was not a fan.
Not a fan, especially not a fan of doing all the creams afterward.
In addition to the rash though, right, she had pretty severe sun sensitivity, lots of hats, lots of sunscreen,
She hated.
which she hated.
Mila did have slowed growth, and she would get nauseous and would throw up a lot when she was really hot.
Gabby experienced rash, nausea, vomiting, fatigue, and perhaps most noticeably hair color change. But she took that change of hair color just like anything else, and she just rolled with it.
The hair color change was an impact. It didn't bother her as much. I will say her eyebrows and her eyelashes did bother her. She felt a little strange about those. At the start of this journey, I was lucky enough to be able to give one of my cousins a call who's in the medical profession. And the best piece of advice that she gave me, and that I would tell you I would pass on to anyone who is starting down this path, is to make sure you are an advocate for your child.
I would say you're your child's biggest advocate. If you have questions, please ask them. Do not be afraid to get all the information you need to be able to feel confident moving forward.
You know, if I was sitting with another mom, or if it was me just sitting there with the first time of this diagnosis, and you feel very alone, but know that your one voice can make a huge difference, not just for your child, but for other families.
Indication. What is Ojemda, tovorafenib? Ojemda is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene. Important safety information. Before taking or giving Ojemda, tell your healthcare provider about all of your or your child's medical conditions, including if you have bleeding, skin, or liver problems, are pregnant or plan to become pregnant. Ojemda can harm your unborn baby. Females who are able to become pregnant, you should use effective non-hormonal birth control, contraception, during treatment with Ojemda, and for 28 days after your last dose of Ojemda. Males with female partners who are able to become pregnant should use effective non-hormonal birth control, contraception, during treatment with Ojemda, and for 2 weeks after your last dose of Ojemda. Are breastfeeding or plan to breastfeed. Do not breastfeed during treatment and for 2 weeks after your last dose of Ojemda. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking certain other medicines can affect how Ojemda works and may increase your risk of side effects. Ojemda may also affect how other medicines work. What should I avoid while taking Ojemda? Limit the amount of time you spend in sunlight. Ojemda can make your skin sensitive to the sun, photosensitivity. Use sun protection measures, such as sunscreen, sunglasses, and wear protective clothes that cover your skin during your treatment with Ojemda. What are the possible side effects of Ojemda? Ojemda may cause serious side effects, including bleeding problems, hemorrhage, are common and can also be serious. Tell your healthcare provider if you develop any signs or symptoms of bleeding, including headache, dizziness or feeling weak, coughing up blood or blood clots, vomiting blood or your vomit looks like coffee grounds, red or black stools that look like tar. Skin reactions, including sensitivity to sunlight, photosensitivity. Ojemda can cause skin reactions that can become severe. Tell your healthcare provider if you get new or worsening skin reactions, including rash, bumps or tiny papules, acne, peeling, redness or irritation, blisters. Liver problems. Your healthcare provider will do blood tests to check your liver function before and during treatment with Ojemda. Tell your healthcare provider right away if you develop any of the following symptoms: yellowing of your skin or your eyes, dark or brown tea-colored urine, nausea or vomiting, loss of appetite, feeling tired, bruising, bleeding, pain in your upper right stomach area. Slowed growth in children. Growth will be checked routinely during treatment with Ojemda. The most common side effects of Ojemda include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection. Ojemda may cause fertility problems in males and females, which may affect your ability to have children. These are not all the possible side effects of Ojemda. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Day One Biopharmaceuticals at 1-877-204-2820. Please see full patient information, including instructions for use, for more information.